For the first presentation for this session, I would like to hand over to Mary Jane Clark from the New South Wales Carers Advisory Council. And Mary Jane's topic today will be Carers Missing Out, a scoping study following the introduction of the NDIS. Thank you, Mary Jane. Over to you.
Thanks very much, Sarah. Good afternoon, everyone. I hope you all enjoyed this morning's sessions as much as I did. I'd like to begin by acknowledging the traditional custodians of the land on which we're meeting today and pay my respects to their elders past, present and emerging. I'm joining you today from Gadigal land. I'd also like to acknowledge my two co-leads on this project, Pam Webster, who is also the Deputy Chair of the Ministerial Carers Advisory Council, and Professor Michael Fine. The three of us have worked together very closely on this project for the past 2 years. Next slide, please. Next slide, thank you. So what's the role of the Carers Council? Our role is to advise the New South Wales Government on policy, legislation and other issues relating to carers. Our membership is appointed by Minister Henskens, who we all met this morning, and the majority of us have current or previous experience of being a carer. We come from a diverse range of backgrounds and professional expertise, and we include people from a diverse range of demographic backgrounds. So we have representatives from metropolitan and regional New South Wales, Aboriginal and Torres Strait Islander community, and from culturally and linguistically diverse communities. The report that I'm presenting to you today was prepared by Tim Brodie from the Centre for Social Research in Health at University of New South Wales and Nicole Webber of Nicole Webber Consulting. Next slide, please. So why did Council commission this report? There are a few issues which led us to do it. First, as you'd all be aware, there's been a really major shift in the approach to care and support services in many areas, including disability and ageing, as we shifted to a very strong person-centred approach. Secondly, Council members became increasingly aware of many complaints from carers that they were being excluded from services, that they no longer had the supports they previously had. And this became particularly evident once the NDIS was established. So we decided to call our project and our scoping study, Carers Missing Out. We suspected that there were three likely drivers for carers feeling they were getting less support than they previously had. Firstly, carers are not directly involved at the point of the NDIS assessment of the service recipient. Secondly, people in need of support themselves often miss out on the NDIS assistance due to eligibility or other access barriers. This, of course, has a major effect on their carers, who often strive to fill those gaps. And finally, we knew that the range of services previously available for carers had decreased substantially. Next slide, please. So our research aimed to establish whether carers of people with disability under 65 years of age are missing out on essential support since the introduction of the NDIS, and if so, who is missing out? Why are they missing out, and what can we do about it? Drawing on earlier research done by Sarah Judd-Lamb of Carers New South Wales, we decided to focus on the three main groups that Sarah's research had suggested were missing out the most. The first of these groups is carers of people with a mild to moderate disability. The second, carers of people with chronic illness resulting in disability. Because we only had a limited budget, we just looked at two chronic illness groups, one who we'd heard were missing out and one whom we heard had better access. So we looked at people living with cystic fibrosis and those with multiple sclerosis. The third group we looked at was carers of people living with mental health issues, particularly those whose issues are mild to moderate or episodic. Next slide, please. Our methodology had four main phases. First, we did a substantial quantitative data analysis. We used a number of data sets, but the two main ones that we drew on extensively were the ABS survey of disability ageing and carers And specifically, we looked at the survey from 2015 so that we could look at pre-NDIS experiences, and then the 2018 survey, so we could look at the post-NDIS experience. And we looked at a lot of NDIS participation data, etc. The second phase of our work was a literature review. Thirdly, we conducted interviews with 15 sector experts, particularly people that had a strong background in the policy shift and what had happened to the service sector as a result of the change, and 10 major service providers. And lastly, but certainly incredibly importantly, we had 6 carer case studies conducted for our report. Next slide, please. So, changes to the service system. Our report found that there were very substantial changes to the service system, and they had a major impact on carers. Perhaps the biggest was that the Home and Community Care, or HAC program, transferred to the Commonwealth, and the majority of carers with a disability no longer had access to HAC services. A key example of that is domestic assistance. To be eligible, people with a disability needed to access the NDIS in order to get HAC services post-NDIS. Secondly, funding for specialist disability support services, particularly respite, as an example, were transferred to the Commonwealth with access limited to NDIS participants. Thirdly, the Commonwealth-funded National Respite for Carers program ceased, and that program ran a number of respite centres across New South Wales. And both Lucy Brogden and Norman Swan spoke this morning about the incredible importance of respite, but also the declining access to respite. Then the Support Coordination Program for Old and Parent Carers ceased. A range of other New South Wales carer-specific services ceased, except for those who were going to access the NDIS. And finally, and very importantly, the National Carer Gateway was established. Now, it replaced some of the missing services, but our study found that a lot of services haven't been adequately replaced once the Carer Gateway was established. Next slide, please. So, in broad terms, who did we find was missing out? Firstly, we found that 60,000 primary carers of people in New South Wales need more support than they're getting. Secondly, we found that nearly 3/4 of people with a disability who need assistance to perform daily activities in New South Wales do not have access to an NDIS package. This has a major impact on carers. The NDIS is a very tightly rationed resource, targeting those with a severe and profound disability. So only 1 in 4 people with a disability are accessing it. Thirdly, more than 120,000 people with disability in New South Wales report a need for more formal assistance. Excuse me. That again has a major impact on their carers who try to fill the gaps. Next slide, please. These pie charts graphically show that 74% figure I mentioned on the earlier slide. You can see in the orange portion of the pie chart, they're the percentage of people with a disability who do access the NDIS. The dark blue portion is those that don't. We were surprised and very interested to see that percentage-wise, people in regional New South Wales actually enjoyed better access to the NDIS than in metropolitan Sydney. Next slide, please. So what were our key findings in respect of the 3 focus groups I mentioned earlier? Firstly, looking at the chronic illness group and also people living with mental health issues group, we found that they're often assessed as ineligible for the NDIS, despite being eligible in many cases according to the terms of the Act. For example, less than 13% of people living with cystic fibrosis who have had severe functional limitations get the help they need. I'd just like to tell you a little bit more about that for those of you who aren't familiar with cystic fibrosis or CF. People with cystic fibrosis typically need lung clearance every morning, and some people need it 2 or 3 times per day. Each session typically takes up to an hour and is very tiring, both to administer and receive. Ideally, it's administered by fully trained physiotherapy. Some families have several children born with cystic fibrosis, all of whom need this service. Many people with CF have a lung capacity of 50% or even as low as 25% or lower still. As a result, they have very severe functional limitations. They get very breathless when they try to talk. They struggle to walk any distance and are often unable to hold down a full-time job. Prior to the NDIS, these people received daily lung clearance with physiotherapy through the HAC program. That ceased once responsibility for HAC was transferred to the Commonwealth, with access now limited to those in receipt of an NDIS package. Sadly, the vast majority of people living with CF who do have severe functional limitations are unable to access the NDIS. They've been declined, we believe erroneously, via a misunderstanding of the condition and the actual functional limitations it can impose on people. Secondly, carers of people living with mental health issues frequently miss out on essential supports, as the care recipients are often reluctant or unable to seek assistance. Thirdly, carers of people with mild to moderate disability often have to be around constantly, as care recipients are ineligible for the NDIS, yet need support. I'd like to share with you an extract from one of the case studies featured in our report. This is the story of Graham and his son Luke. Graham is aged in his early 60s and is the primary carer for Luke, who is in his early 30s. Graham has been Luke's carer since his son was a teenager. Luke lives with autism, dyspraxia, and mental health issues that mean he experiences very severe social phobia. Graham provides practical and emotional support to Luke on a daily basis. He helps Luke to plan healthy meals, prompts him to shower, and takes him to appointments. Luke will not leave the house without Graham because of his social anxiety. Just prior to the NDIS, Luke had been accepted into the Personal Helpers and Mentors program known as FAMS. Under this program, Luke would have been allocated a personal mentor to support him with everyday living tasks. It would have made the world of difference to both Luke and his dad. Sadly, just before Luke was to commence his mentoring program, FAMS closed their books to all but those in receipt of an NDIS package. Though Graham is confident that Luke would qualify for an NDIS package, Luke has so far refused to submit an application, and his mental health issues affect his ability to do so. And Graham cannot apply on Luke's behalf unless Luke agrees. Graham is apprehensive about what will happen in the future. He'd like to see his son living independently, but Luke would need funded supports for that to happen. Support with social interactions, shopping, and maintaining important daily routines. Graham says he finds it challenging that the NDIS terminology does not recognise his role as a carer. Without access to the NDIS, there is no support for Luke other than what Graham provides. Graham never gets to switch off. He says, "It's not how I imagined life would be with a 30-year-old son." And the final point on the slide, many carers of these three groups can require higher levels of support than those caring for someone with more profound disabilities. It isn't actually a direct correlation between the level of support the person with the disability needs and the level of support a carer needs. Carers' support needs are really dependent on the circle of supports they have around them, and many people looking after our three primary focus groups have very high levels of support that they need. Next slide, please. So what do we do about it? Where to from here? Firstly, we believe that in situations where a person with a disability does have a carer, their carer should be involved in the NDIS assessment process to ensure that participant needs are met, carer needs are acknowledged, and plans are efficient and sustainable. Also, carers must be recognised in relation to their own needs. And to this end, development of effective referral processes between the NDIS, the Carer Gateway, and mainstream support services is essential. And the last point on the slide, we strongly believe that the Carer Gateway services must be adjusted iteratively in response to carer needs. One key example that we're concerned about is that access to respite and domestic assistance can be granted on an emergency basis, but only $3,000 per year are available for those services. It doesn't give you access to planned respite, although I think there may be opportunities for that, but it's certainly not a standard service on offer under the Gateway, and the funding available for respite and domestic assistance is very limited. Next slide, please. Right, thank you. NDIS assessors must receive clear guidance regarding consistent application of NDIS eligibility criteria, including a focus on the functional limitations resulting from disability, to ensure applicants are not erroneously excluded from the scheme. As I mentioned before, we're particularly concerned about those with chronic illnesses and those living with mental health issues. Finally, the Carers Council strongly believes that additional services are needed in New South Wales to address the needs of carers and people with a disability who remain outside the NDIS. The report makes a strong case for reinstatement of readily accessible basic information, advice, and peer support services for carers as a form of cost-effective primary care that would complement the online services currently available through the Gateway. In addition, access to some forms of direct assistance, such as respite, are very important. So we believe that the evidence outlined in the scoping study I presented today demonstrates a pressing need for effective strategies and initiatives to address these issues. Final slide, please. Full copies of the report and the executive summary will shortly be available at that email address, and we'll notify Carers New South Wales when the report goes up on the website. So thank you all very much for listening, and I'll now try to answer some of your questions.
Fantastic. So thanks so much, Mary Jane, for a very informative presentation. And we do now have a few questions, a few minutes for questions. So we haven't had any live questions come through yet, but now's your time to our audience. If you would like to ask Mary Jane a question about her presentation, to please use the live Q&A icon and to type your question there. And we've just had an excellent presentation, Mary Jane, comment come through. So I'll start with a couple of my questions while we wait for some other live questions to be added. I guess one thing that came to mind for me, Mary Jane, was have the findings of this report been discussed with others on the New South Wales Carers Advisory Council, and particularly what was the response of the carers on the council? Did they resonate with the experiences in the report? What were their reflections, if any, around some of the key findings that you mentioned?
Yeah, thanks, Sarah. Certainly we've been engaging with the Carers Council throughout the preparation of this report, and they've seen earlier drafts, etc. So very much the report has tried to reflect the views of the council members. Of course, being a disparate group of members, we do have some differing views, but I don't think, I could be wrong, so I'm sure my fellow councillors will correct me later if I am wrong. I don't think there's anything in the report and in the findings that council members would disagree with. We'll be meeting again in a few weeks, and one of the things we'll be looking at is how to action the recommendations or the key findings in the report to try and drive some reform.
Fantastic. And we've just actually had a question come through here now. It's actually a comment. So just thank you for your presentation. Interesting findings highlighting the gaps in services and how the NDIS act can seem to be an interpreted act at times. Thank you for that comment. A couple of other comments, thank yous coming through. And we had one here that is around the Carer Gateway comments that you made, and saying that there was an expectation that the Carer Gateway would allow for planned respite. I guess just to add something on that, I know you said, Mary Jane, that there wasn't really room for planned respite. So I think the sort of respite that you referred to, respite and domestic services, they would come under the capacity for planned respite under the Carer Gateway, separate from the emergency respite provisions. But as you've noted, they are a bit limited. And so I guess my other question that I had around that was, you mentioned that there needs to be more support outside of the NDIS. Is there anything in particular that you think that could be established outside of the NDIS that would be particularly helpful for carers at this time?
Yes, Sarah, the things I mentioned towards the end of the presentation are the sorts of things we thought were very important. Agreeing with both Norman Swan and Lucy Brogden, we think more access to planned respite is incredibly important. We think just some basic primary care services that used to exist in New South Wales, such as a broad network of carer support groups. We do know that online carer support groups are available through the Gateway, but we think that the face-to-face ones should continue to be resourced if possible. Improved access to advocacy and referral. So at present, carers really have to go through the Gateway now to receive advice as to what services are available. We think it'd be very good if some more primary services are available for carers to go to as a first point of contact to find out more about what's available for them. But there are many other examples mentioned in the report. That's just a flavour of a few.